Namaste, welcome, bienvenue. Welcome to this first healthcare summit jointly organized by NatHealth from India and the African Healthcare Federation. We've had cooperation between Africa and India in the healthcare field informally for many decades. This is a unique attempt at formalizing that relationship of South-South cooperation and leading to universal healthcare in both geographical areas. Access to healthcare, quality of healthcare, affordability are both of prime importance on both sides. And we hope that through this joint effort, which will continue for the months and years to come, we would be able to achieve universal healthcare, which would benefit the healthcare providers, the patients on both sides. So welcome again. Have a good day. Stay safe. Bonne journée. Restez en sécurité.
The upcoming India-African Summit is a rare opportunity for policymakers and industry leaders across the globe to be able to exchange ideas, deliberate on core issues that affect the bedrock of healthcare. It is the first time in which we can have that close collaborative effort, the importance of strategic partnerships between Africa and India, to be able to share best practices, experiences, research, trends, and insights. It will be an opportunity for everyone not to miss. As the African Health Federation, we look forward to fruitful deliberations and welcome you there. Thank you.
A very good day, ladies and gentlemen. It's indeed a great pleasure for us to know of this cooperation between Africa and India. India and Africa traditionally have always been cooperating in a very informal way. But this new platform will give wider coverage to all kinds of interactions between our medical communities across different geographies in Africa. I would consider that the knowledge transfer, especially training of young individuals, doctors, nurses, paramedics, etc. I think if India can assist and support in that process, that will be of great value to both sides. At the same time, it is also very, very important to recognize that there are a lot of common learnings because of our shared problems, which are pretty similar in nature. I wish all the success to this great initiative.
India-Africa Health Summit is an opportunity for us to exchange professional knowledge and skills besides strengthening health systems, particularly in diagnostics. Events like this help augment the potential of healthcare sectors in both India and Africa. My best wishes to all the participants.
Today at this historic event, the India-Africa Health Summit, we are looking to expand cooperation across India and Africa towards the goal of universal health coverage. We are witnessing the launch of a global healthcare platform which will build the foundation for transformational healthcare delivery at an international level and facilitate a strategic dialogue between key stakeholders within the healthcare industry. I wish the Indian-African Health Summit the very best. God bless.
India and Africa both have some deep-rooted fundamentals in the healthcare landscape. Both countries have strong healthcare models and can certainly collaborate more strongly to expand their horizons through mutually beneficial and fruitful partnership to achieve universal healthcare. Both countries carry a rich heritage of valuable traditional medicine systems that has to some extent been integrated with the modern medicine systems. Therefore, the sharing of experience, expertise, and know-how in this space could lead to a win-win outcomes for people living in both India and Africa.
The forthcoming India-Africa Healthcare Summit in December this year, organized by NatHealth and Africa Healthcare Federation, promises to be a landmark event. The summit features a powerful dialogue led by the leading healthcare providers of India, the leading healthcare providers of many of the African nations, and the governments from the respective countries. The dialogue will focus on collaboration as a theme and partnerships as a means to address the several challenges faced by these two continents. Partnerships in the form of private partnerships and partnerships between public and private. The summit will propose a way forward built on this collaborative platform to move the two continents towards universal healthcare. I wish this summit huge success.
As healthcare is witnessing great transformation across the world, this summit is very timely because both India and Africa have some common issues to discuss with, and yet there has been a history of significant partnership, trade, knowledge exchange, and entrepreneurial activity in both sides of these nations. I think this forum will set stage for a long-term partnership and dialogue, as well as cooperation in healthcare and innovation across the years.
In light of the pandemic, the time is right to explore new collaborations which would be mutually enriching. The creation of the Africa Healthcare Federation in 2016 was a significant milestone towards this objective. This summit will set the tone for partnerships which can build the capacity of local populations and organizations in both countries. Participate in this collaboration by joining us at this summit on 12 December.
This year, because of the COVID pandemic, we've had an opportunity to review our health systems holistically. And I am happy that this summit is happening, and it's going to discuss the implementation of the Sustainable Development Goals and also give an opportunity for experts to share best practices across regions, and probably an opportunity to collaborate to reduce the burden of NCDs in both our continents.
The Africa Healthcare Federation is pleased to collaborate with NatHealth to bring this summit where India and African countries come together to propose collaboration and share ideas in improving healthcare systems in both parts of the world. This South-South collaboration is much needed and it's long awaited. It's an opportunity for decision makers, regulators, private sector players, champions, and other stakeholders, including NGOs, to come together and promote healthcare in both parts of the world. India has a strong experience and strong healthcare system, similar as Africa does, and this is an opportunity to share best practices and improve and increase collaboration between India and Africa.
Let me take this opportunity to congratulate NatHealth and Africa Healthcare Federation to bring key stakeholders from both the countries and continents together. This summit is an opportunity for industry leaders and policymakers to exchange knowledge, deliberate ideas, discuss core issues which are at the bedrock of the healthcare sector. India and Africa together can chart a new path for a sustainable and a disease-free world in the coming years. The medical technology sector, which is a fast-growing sector, offers a great opportunity and potential for African nations to look at India for affordable products.
Africa Healthcare Federation is pleased to collaborate with NatHealth, and we look forward to exchange programs in the area of skill training, medical education, training health workers, and human resource management. This summit is the beginning of working together and learning from each other on how to tackle and mitigate the increasing disease burden, especially non-communicable diseases. India and Africa can together chart a new path for a sustainable and disease-free world in the coming years.
Millions of years ago, India and Africa were one landmass. Technological forces and geopolitical realities are bringing them again together, especially in the healthcare sector. Telemedicine, medical tourism, and friendshoring, by which I mean not random offshoring, but offshoring with those countries with whom you have had long years of peace. These are the three forces which are bringing us together. We hope that India-Africa Health Summit will further energize these forces. All the best.
Et l'Inde ont toutes les deux un paysage sanitaire permettant de développer un partenariat fructueux et mutuellement bénéfique. Nous attendons avec impatience les programmes d'échange entre la Fédération africaine des soins de santé et la Nat Health dans les domaines comme la formation professionnelle, l'éducation pour la santé et la gestion des ressources humaines. Le but ultime étant de contribuer à la réalisation de la couverture sanitaire universelle dans tous nos pays.
Hi everyone. The Indian and African healthcare systems have so much in common. We are both incredibly proud of our heritage of traditional medicine and its integration with modern medicine and surgery. We have a vast population that is underserved, that doesn't have access to basic screening, diagnosis, medical and surgical care. We are both combating not only communicable diseases, but a fast emergence of non-communicable diseases, including cardiovascular conditions, diabetes, cancers, obesity, and arthritis, just to name a few. I think we have a collective responsibility to invest in our healthcare infrastructure, to focus on quality of outcomes, to usher in a digital revolution, to train more healthcare workers, to upskill our current healthcare workers so they can deliver the outcomes that are deserving of the best healthcare systems in the world. We have a responsibility to provide the best outcomes for our patients in rural Africa and India, the same outcomes that our patients receive in the urban centers. We are very proud of our collaboration between the African Healthcare Federation and NatHealth to learn from each other, to share best practices, and partner on meaningful initiatives that are evidence-based. So we are looking forward to this partnership.
Bonjour, je suis le Dr Joseph Bonifo, président de la plateforme du secteur privé de la santé de Côte d'Ivoire et membre du conseil d'administration de la Fédération africaine de la santé. Le 12 décembre 2020 aura une sous forme de téléconférence la première conférence Inde-Afrique ici les systèmes de soins de santé. Je vous invite à vous inscrire de manière à participer massivement à cet événement qui me paraît très important. Surtout, ne vous laissez pas raconter l'événement. À très bientôt.
And I'm so pleased that we will be participating in the India-Africa Health Summit on 12th of December. These two regions have so much in common in terms of healthcare needs and access, and there's a tremendous amount that we can share with each other and learn from each other. I thank the African Health Association for joining us as part of this event.
The India-Africa Health Summit 2020 is a great occasion for all the stakeholders from both the regions to come together and exchange ideas on important aspects of healthcare, most importantly, how to achieve universal healthcare. I would encourage all the stakeholders to come together and make this as a grand success. Thank you.
COVID-19 pandemic is a catalyst for collaborative solutions to healthcare on the continent and globally. COVID-19 has opened up cracks in our healthcare systems and exposed the unpreparedness to cope with the crisis. The summit between India and Africa is an opportunity for policymakers and industry leaders from across the world to explore strategies, seek solutions, bring about increased investments, and ensure improved capacity across the various sectors to resolve present challenges and to help capacitate future preparedness.
Africa Health Summit is reflective of our firm commitment to provide access to quality, affordable healthcare to all our people. It's an opportunity to explore new partnerships for providing telehealth solutions at every doorstep and for ramping up our medical education. Together, we can undertake new R&D initiatives to combat the threats of new and emerging diseases, pandemics, and the non-communicable diseases. India and Africa can together paved the way for a new disease-free world.
To achieve the Sustainable Development Goals, it is important to focus on two regions, Africa and the Indian subcontinent. These regions have similar challenges and constraints around health, nutrition, water sanitation, governance, and socio-economic empowerment. At the same time, there is enough knowledge as well as best practices which can be shared with each other and best experiences learned from each other. It is important for the government to collaborate with private sector, donors and other stakeholders and focus on the South-South cooperation to make this dream a reality. I am happy that this summit, which is very important to promote South-South collaboration and cooperation, is happening at this time.